Okay, so this week we're assigned to talk about epidural use during labor. So what is an epidural? An epidural involves placing of a catheter in the epidural space of the lumbar spine. Short-acting opiates are infused to provide localized pain relief while allowing laboring women to feel contractions and bear down as needed. According to Johns Hopkins Medicine, 60 to 70% of women in the United States elect to have epidurals for labor, while other sources that are based out of the United Kingdom, for comparison, say that 40% of them have them there. This may vary from country to country, and unfortunately I was unable to get my hands on the global percentage of women who have them. However, the fact that two very similar countries, socioeconomically speaking, have such different numbers suggests that the percentage of women who receive them in a given country is not solely based on status. Although epidurals are mostly safe, no medical procedure is without risks. There is a risk of hypertension, brady or tachycardia, respiratory depression, and allergic reaction, as well as a low risk of spinal puncture, 1% according to Johns Hopkins. Other common side effects are lack of sensation in the abdomen or legs, urinary retention, and nausea and vomiting. The medications that are given through epidural injections are fentanyl and sufentanil. Both of these drugs are opiates, binding to opiate receptors in the CNS and altering the perception of pain. As a nurse, it is important to assess pain and vital signs before and during treatment with these drugs. One nursing diagnosis that can be associated with epidurals is acute pain related to labor. With this, you should be assessing pain every so often, as well as vital signs, as you would with administering any sort of opiate to begin with, no matter what the route. All this is keeping in mind the goal of effective pain management without any excessive sedation. When educating the patient, you want to be sure to educate them about the procedure of placing the epidural, such as lying on their side, the analgesia that'll be applied before its insertion, and the sensations that they may feel when the epidural is inserted. This sensation would be a slight pressure in the lumbar region. Also make sure to mention that it may take up to 15 minutes to receive any pain relief, as well as a gentle reminder that it will not take 100% of the pain away from labor. Also educate them on the benefits, potential side effects that were previously mentioned, as well as some alternative options. That concludes my video on epidural injections. I will be including the Johns Hopkins article that I referenced in my submission. Thank you.